G'day and welcome back to the channel. So in today's video, I want to show you one of the best low back taping techniques that I've seen clinically that's fantastic for low back pain and low back dysfunction in general. And it's a really simple way to do this, so you can obviously do this yourself, although it can be a little bit awkward to do yourself. It is best to do with a partner. So I've recruited the help of my brother. So what I'm going to do is I'm going to tape up the back and talk about how you should be doing it and some little tips and tricks you need to know to make sure that you get the most out of this taping technique. So this low back taping technique is really good for two main reasons. The first one obviously is that it will give you a really good understanding of where you need to be posturally through your lower back. And the second thing is it's really good at protecting and giving a specific section of your lower back a break, allowing some of that pain, some of that stiffness, that tightness, some of that dysfunction to give it an environment from which it can settle a lot faster. So essentially what we're going to do is with this rigid tape, this sports tape, we're going to tape a rectangle onto the back, making sure that we get the top of the pelvis, the base of the rib cage, and then some strips either side to protect that part of the back. Because what we generally tend to see with a lot of back pain is that the junction between the rib cage and the lower back and the low back and the pelvis tends to be an area that a lot of people tend to accrue dysfunction, whether it's wear and tear, disc bulges, stenosis, nerve root irritations right down the base of the spine, or even that more hidden sort of upper lumbar, lower thoracic spine pain that we've talked about all on the channel, which can even refer down to your lower back and down to your hips and even down to your legs, which a lot of people don't tend to notice until it's looked at or until you go hunting for that. But the idea with the taping technique is we're going to keep all of that area within the tape to try and turn the lower back from a bunch of individual segments that we might be hinging through or potentially slouching through without realizing it into a more one-dimensional trunk, so that when you're moving around and doing the things that you need to do day to day, you're going to be forced to move through your hips more than individualize those segments of your back, which you may be doing without even realizing, and perpetuating that low back dysfunction. So as I said, the tape's really good to try and give you a great understanding of where your back position needs to be day to day. So if you tape yourself up or have yourself taped and then go and sit down in your car or in your couch, if you do this before you go to work or anything like that, if you find that the tape stops you from getting into the position that you would normally try and get into without thinking about, then you might want to reconsider that shape, because that shape may be one of the hidden underlying causes of your low back pain or general dysfunction. So again, what we're looking at here is right down the base of the spine. We want to make sure that we're looking for the dimples at the top of the pelvis. So this signifies essentially where we want to lay the tape over the top. And then we want to make sure that we can also find the base of the rib cage and go from there. So remember, we're trying to tape the lumbar spine within this tape. We're trying to trap the lumbar spine within this tape to give it a break and allow things to settle long term. So what we want to do is we want to get one strip of tape essentially across the base of that spine. So again, you can use scissors. And again, we just want it to go across the base of that the base of the spine at the top of that pelvis. The second piece of tape, we want it to come up a fair bit higher. And this is often a lot higher than people tend to realize. But we want to go just above the base of that rib cage, just before it turns into your lower back. And then from here, all we're doing is reinforcing the ability for this spine not to move. And instead of just dropping the tape on top, just to make sure that there's a really good amount of tension here, I like to pull a bit of skin underneath before I place the tape down and before I smooth it out. This just basically improves the position of the tape, but it also makes sure that there's no excess slack in there, so that when you stand up and move around, you don't feel like the tape gives or bends unnecessarily. And again, you can do this a number of different ways. You can tape on top of this one, or you can tape just next to it. I'm just going to tape next to it just to make sure that we really emphasize the position that we're trying to protect here. So again, just pinching a little bit of the skin there, so there's a little bit of a crease over the top of that tape. Another one on this side just to make sure that it's positioned correctly. As I said, this is a very simple tape job. It's nothing too fancy. And again, you can keep this on for probably 2 or 3 days before the tape tends to lose its rigidity, or before your skin gets a little bit irritated. But obviously you can take this off and sort of recheck it and redo it again if you feel like you need to do a better job of it. And now I'm just placing some tape over the top just to lock off those strips. And basically all that is exactly what we need to do. So from this position, as you can see, there's a rectangle taped in there, so you can have some low back pain or dysfunction anywhere within this, but by making sure that the tape is above your pelvis and at the base of that rib cage, we're essentially turning my brother's trunk into one segment, or at least one segment through here. So when he gets up and moves around, he's going to have to move through his hips more instead of unknowingly bending through his back and potentially contributing and perpetuating that dysfunction. So as I was saying, the two main reasons why this tape is fantastic, apart from being very simple and easy to do, is it does give you a very strong impression of where your back should be ideally in space, but it also gives that tissue in your back a break. So what you should hopefully find is once you've done this for a couple of days and you take the tape off, you deserve to feel like your back is a little bit looser, hopefully a little bit less tender, maybe it moves a little bit better, but more importantly, anything this tape tells you over the next few days is really important to try and capture once the tape comes off. So if you are sitting on the couch and the tape's holding you up in a really straight position and your back isn't sinking into the chair, then make sure that you put a pillow or a cushion to fill that gap while the tape's on, so that when the tape comes off, you know that you have that position sorted and you can try and replicate the same shape. Similarly, if you're someone who doesn't sit very often, but you tend to sort of stand and lean over a lot, the positions that your back will be able to get into with the tape on will be different most likely to the ones that you'll default to without realizing. So we want to make sure that while the tape's on, you try and practice bending and moving through your hips as opposed to bending and moving through your back. And then obviously once the tape comes off, you can try and practice the same movement habits and movement shapes and try and replicate that long term. So for anyone who's dealing with long-term low back pain, or even if you just feel like your back is a bit stiffer and tighter and less functional than you'd like it to be, this lower back taping technique is a really simple and effective way to change some of those symptoms really quickly. So let me know in the comments down below how you found this tape went. If you enjoyed this video and you'd like to see more, please consider subscribing to the channel. Leave a like rating on the video if you did enjoy this content. And if you found it genuinely helpful, please consider leaving a super thanks donation on the video. It's just a great way to help support the channel and allow me to keep making these types of videos. With that being said, thanks for watching. I hope it was helpful, and I'll see you in the next one. Bye.